In this video we're going to be talking over the anatomy of the ear. We're going to talk through the external, middle and inner ear, how sound is transported through these structures and to the brain. Okay, so let's start things off with a simple diagram. The external ear can be divided into three main structures: the pinna, or the auricle, the external acoustic meatus and the tympanic membrane. After that we have the middle ear. This contains the ossicles, and we're going to go over them in detail later on. Finally, the inner ear is made up of the cochlea and the vestibule, which are for interpreting sound and balance respectively. Okay, let's talk about the external ear in some more depth. The pinna, or the auricle, is made up of elastic cartilage. The only other portion of the body made of this is the epiglottis. The first two landmarks I want to draw your attention to is the helix and the tragus. I think they're quite easy to remember, and they lie adjacent to the antihelix and antitragus. After that you have the lobule and the concha. The external acoustic meatus directs sound down to the tympanic membrane. The first third lies within cartilage, and the second two-thirds within the temporal bone. After that we have the tympanic membrane, but I'm going to talk about that in a minute after I've gone over the middle ear. The middle ear contains a lot of structures, but an easy way to remember it is that there are 3 bones, 2 muscles, and 1 nerve. The bones are the ossicles. They are the smallest bones in the body, and they're the same size when you're born as when you're an adult. The reason for this is thought to be for speech and language development purposes. The first of the ossicles is the malleus, which I've labelled here with an M. It's made up of the handle and the head. After that we've got the incus, which is made up of a body and then a long limb. Finally we've got the stapes, which is the smallest bone in the body. It's made up of the head, the anterior and posterior limb, and then the body finally. The ossicles lie in the tympanic cavity. The head of the malleus and the body of the incus lie in the epitympanic recess. Moving on to the muscles. The first muscle is the tensor tympani muscle. This originates from the eustachian tube and inserts on the handle of the malleus. Its action is to pull the malleus medially when there's a loud noise, and is innervated by the mandibular branch of the trigeminal nerve, the 5th cranial nerve. After that we've got the stapedius muscle. This is the smallest muscle in the body. It originates from the small pyramid and it inserts onto the stapes. Its action is also protective and is innervated by the facial nerve, which is the 7th cranial nerve, which passes straight by. Okay, one last structure we can't forget is the eustachian tube. The eustachian tube attaches, or it connects the middle ear to the nasopharynx, which allows for pressure equalization. Right, moving on to the tympanic membrane, like I said we would do. Tympanic membrane is made up of 2 main structures, the pars flaccida and the pars tensa. The pars flaccida extends around in this annulus tympanicus, and then you can see these parts of the malleus on the tympanic membrane, the lateral process and the handle of the malleus. And then finally you've got this cone of light, which isn't an anatomical structure, but it's present when viewing the tympanic membrane. Okay, I'm just going to draw the middle ear once more so that we can go over the borders of the middle ear. For the borders, the middle ear is effectively a cube. So if I draw in the ossicles to get you orientated here, and then all of the borders are quite logical. So laterally, the border is the tympanic wall, because of the tympanic membrane. Medially, it's the lateral wall of the inner ear. Superiorly, you have the temporal bone, specifically the petrous portion of the temporal bone. Inferiorly, you've got the internal jugular vein, so you've got the jugular wall inferiorly. Anteriorly, the carotid wall, and posterior is the mastoid wall. I just want to take a second to mention that the eustachian tube does not only run inferiorly and medially, but also anteriorly, which hopefully is clear in this diagram. As I've just mentioned the mastoid wall, I want to quickly mention these mastoid air cells, which are in the mastoid part of the temporal bone. So they're not so much superior, they're more posterior than superior, but just to remember they're there, I'm going to draw them in. The purpose of the mastoid air cells is thought to be protective and for also as a pressure buffer for the middle ear. The most important thing to know is that in untreated otitis media, so infection of the middle ear, an infection can develop in these mastoid hair cells and lead to mastoiditis. The last 2 points of the middle ear that I haven't mentioned are this where the stapes connect, the oval window, and that's the beginning of the cochlea there. And then beneath that you have the round window, which is where the cochlea ends. And that pretty much concludes the middle ear. So last but not least, let's move on to the inner ear. The inner ear is comprised of three main structures: the semicircular canals and the vestibule. These two are both involved in detecting balance. And then the cochlea, which is involved in sound processing via all these structures we've been over already. So fundamentally, these three structures all have a very similar structure. So they're made up of an outer bony labyrinth, which is what I've drawn in already. That's filled with perilymph. And then within that, you have this inner membranous labyrinth filled with endolymph, which is a potassium-rich substance. And any more physiology specifically for how the endolymph works is probably beyond the scope of this video, I'm afraid. The semicircular canals, there are three on each side. You have the lateral canal, the posterior canal, and the anterior canal. They're involved in the detection and interpretation of rotational and angular acceleration. Each canal is filled with endolymph and ends in the ampulla, where that acceleration is actually sensed. After that we have the vestibule, which is this whole section here. That's made up of the utricle, which lies superiorly, and then the saccule below. And these are involved in the interpretation of horizontal and vertical acceleration. We briefly touched on perilymph earlier on. Perilymph is this fluid, so as the stapes hits the oval window, the perilymph flows up the cochlea and then back down the other side, as you can see here. In between those two layers, you have the endolymph-filled cochlear duct. Alongside it, you have that channel that flows all the way up. That is known as the scala vestibuli, because it flows from the vestibule. And below you have the scala tympani. And the last thing I want to make a note of is this central pillar that the cochlea rotates around. That's called the modiolus. I'll try and make that a little bit clearer on this next diagram. So here you can see I'm just taking a cross section of the cochlea now, just to get another clear view. That's the modiolus, that pillar up the middle, straight up to the top. And then with an even more zoomed in cross section now, you can see the cochlear duct in the middle. The scala vestibuli lies above the cochlear duct. The scala tympani lies below. Lateral to the cochlear duct we have the spiral ligament. Separating from the scala vestibuli is Reisner's membrane, and separating it from the scala tympani is the basement membrane, which gives rise to the organ of Corti, which is where there are hair cells involved in turning the sound and the oscillations through the endolymph into an electrical signal sent via these branches of the cochlear nerve. Like with the endolymph, I don't have quite enough time to go over the physiology of that in this video. As I've just mentioned, these branches of the cochlear nerve, they fuse to form the cochlear nerve itself. The cochlear nerve fuses with the vestibular nerve to form the vestibulocochlear nerve, which is the 8th cranial nerve. That runs alongside the facial nerve through the internal acoustic meatus, and they both attach to the pons. The final structure I'd just like to mention is the endolymphatic duct. This lies in the inner ear and it's in contact with the dura mater. Its role is to both absorb and secrete endolymph so that this fluid is constantly replaced. Okay, so I'll recap. We've been over the anatomy of the ear. We've talked through the external ear, including the pinna, the external acoustic meatus, and the tympanic membrane, where sound is transmitted to the middle ear via the tympanic membrane. Within the middle ear we have 3 bones, 2 muscles, 1 nerve, and a eustachian tube down below. There are 6 borders to the middle ear that we've been over as well. Next, moving on to the inner ear, we've talked through both perilymph and endolymph, how these flow through the cochlea, where sound is interpreted. We've also talked through the vestibule and the semicircular canals and what their role is, respectively, in balance. And that finally brings us to the end of this video. I hope it's been useful. I hope that it's been a fairly concise overview of the ear anatomy. If there's anything that hasn't been clear, feel free to leave a comment below. Any feedback otherwise would be very much appreciated. Thanks for watching and see you soon.